This meeting is being recorded.
Hi, everybody. I just want to say I hope everyone's having a good afternoon. And I want to welcome you to the Resident and Family Support Council that we have on the second and the fourth Tuesday of every month at 3 o'clock. And I see as people are still continuing to join, I'll just remind everybody, the purpose of our meeting is to really empower those people that live in long-term care facilities or people who love somebody in a long-term care facility with information so that you can feel like you can live that life that you need, you want, and you deserve. Also, I wanted to let everybody know about our YouTube page. So if you're not able to make one of these meetings, go onto our YouTube page. We do record all of these, as you just heard. As I did the entrance right now, the welcoming, we are recording this meeting. All you need to do is go to YouTube and type in the search bar Illinois Ombudsman, and it will come right up for you. We've got a lot of great videos there. We're really being able to get a really nice stockpile of videos that can really help people navigate this really complicated path of long-term care. I also want to just take a moment to thank the Illinois Pioneer Coalition, who so kindly lets us use their Zoom account that we can have these on every the second and the fourth Tuesday of every month. And I do want to ask everybody if you could please put your zip code into the chat. That way then we know where people are participating from throughout the state. And then there's one last thing I want to just ask everybody to do is get on our Facebook page. I do a lot of the reminding about the meetings. The link to the meetings are there. And plus we just post other information that you might find useful on our Facebook page. So do get on. And again, if you're a Facebook person, just get into the search. You could type Illinois Ombudsman and it should come right up for you. And like our page, follow our page, and hopefully you'll find it as useful as we're hearing some people are really finding it useful. So today, I'm really excited about this conversation. I think that this is a really important conversation to have. And we've got Craig Sever here from Everspring Pharmacy, and he's the clinical director for Evergreen Pharmacy. And we're going to be talking about the importance of knowing your medications and what they are for, which everyone really does need to know what medications you're on. And I mean, this even includes non-prescription medications because sometimes they can have reactions with some of the things that you might be taking. So this is a really important conversation, and I'm so excited. We have Craig here, who's a very person-centered pharmacist who can help us have that conversation. Welcome, Craig.
Thank you. I'm assuming everyone can hear me, so if not, just let me know. We're good. All right, perfect. So thanks for having me. Thanks for showing up today. Not sure what it's like in your part of the state, but down here it's partly sunny, partly cloudy, I guess, depending on whether you're half empty or half full kind of person, and beautiful 80 degrees. So I'm sure everyone would much rather be outside enjoying the weather. So thanks for taking an hour out of your day to come listen to me babble. Lee sent me a few things, some things she wanted to kind of discuss, to go over. And I've taken those kind of talking points and have expanded on them. I've got 10, 12 things we're going to kind of discuss today. I want to keep this very conversational. I don't want you guys to hesitate to ask questions. So throw it in. I've got the chat box open. I will continue to try and monitor that as best I can. And I want this to be very laid back and relaxed. I only ask that you, get something out of it. Hopefully you learn one useful thing. And if you do, then we've made it all possible. And if you, think of something that sort of stimulates your brain a bit, even better, we'll go from there. Okay. A little bit of background on myself. I've been doing this I've been a pharmacist since 1987. I graduated in the St. Louis College of Pharmacy for the first 13 years-ish. I worked at a 500-bed acute care hospital. I specialized in intensive care, trauma code, trauma team, and infectious diseases. About 2000, I had an opportunity to go to the long-term care side of things as a consultant, doing chart reviews, lab reviews, that sort of thing. It fit in very nicely with what I had done working at the hospital because we were very much clinically active on the floor. I had a 1-year-old daughter at the time, and the job offer was no weekends, no holidays, Monday through Friday, and 8 hours a day. And oh yeah, by the way, you get a raise. So that was kind of a no-brainer that I was jumping ship to explore better options. Let's just say. So I started that back in 2000. Is primarily geriatric and developmentally disabled population. That's my two areas that I focused on. As we've gone on in time, those two distinct populations have sort of become a little bit more one, because we find that our developmentally disabled folks are living longer. So now we have geriatric developmentally disabled folks, which is fine because it plays right into what I've been doing. So today, let's get going. We're going to talk about kind of the reasons you take your meds, information about why you take them, should you take them, shouldn't you take them, are they good, are they bad? We'll talk a little bit about OTCs, supplements, trade products, generic products. We'll touch briefly on a couple of other new things that maybe are in the forefront that you see a lot about. Some I'll talk about a little more than others, and I'll explain that when I get there. So,
Okay, and Craig, an OTC
yes.
stands for?
Over-the-counter medications. Okay, so and I will get to that. Okay, over-the-counter meds are basically anything that you can buy off the shelf at Walgreens, Target, your local pharmacy without taking a prescription in. Okay, do not, and I will go over this again later, but do not make the mistake that just because you can buy it over the counter, it's just fine and dandy and won't hurt you. Okay, because that's not true. Okay, so let's get kind of started. Very simplistically, why are we taking meds to begin with? There's a lot of reasons for taking medications. Okay, you can be treating it. You can be treating a known illness, infection, something like that that we know is going on with you at the current time. I have sinusitis. I have a sinus infection. I have a urinary tract infection. I have a cut on my arm that's gotten infected. Those are kind of common things people will see and use. Not too unusual, and pretty self-explanatory. Then we kind of get into why we take meds, and that's going to be more for a preventative factor. Okay, so and think of it that way. We know that we're going to be predisposed to something in the future. For women, especially elderly women, maybe it's osteoporosis. So we're taking calcium or we're taking vitamin D to help build our bones. Okay, maybe we have a lot of predisposing conditions that will open us up to a stroke. So maybe we take aspirin daily for a stroke. Okay, so things of that nature that we kind of can classify as preventative, but would be preventative in a necessary standpoint. Okay, the third reason, major reason that we have is to kind of supplement the body in areas where it either is no longer able, maybe it was never able to support itself. Along those lines, I want you to think of things like thyroid medications for folks that have had thyroid issues, very prevalent in the female population. Okay, diabetes. If you have diabetes, you need some sort of supplement there for your blood sugar control, right? That might be oral meds, it might be an injectable insulin, but we just can't have you walking around with really high blood sugars because of all the long-term damage it does to your body. Okay, so think of those areas as supplements, but they're necessary supplements because you're treating something that your body can't take care of on its own. And then the fourth one is, again, I say preventative, but it's sort of a necessary preventative. And I want to think of those as the things that we use to treat perhaps reemergence of cancer. If you're on a long-term preventative measure for cancer, if you've had an organ replaced and you're taking meds to prevent organ rejection. Okay. In both of those cases, the causative issue is probably no longer there per se. In organ rejection, obviously it is, but in more than cancer, you may have had your cancer removed, you may be, quote, cancer free, but you might still be taking meds to prevent a reemergence. Okay, so that's kind of another class. They're all similar and yet they're all different. So just kind of understand that there's a lot of different reasons, but usually there always is a reason. Okay, so you say to yourself, well, Craig, how do I know what my meds are for? The quickest, simplest, and easiest way to answer that question is when the doctor says, I'm going to give you something for XYZ. You say to your physician, okay, what's the med and exactly what am I taking it for? because you may go into the physician and you may have more than one problem. You may have 2 to 3 things going on, and he says, I'm going to give you this, and I'm going to give you this, and I'm going to give you that. Okay. Don't guess which is which. Ask him, okay, doc, what's XYZ for? Well, that's for my hypertension. Okay. What's ABC for? Oh, that's for my high blood pressure or my high blood sugar. Okay. Now, you know, all right. If it helps you, and I do this with my own mother, she is going to be 81 years old this year. I tell her, Mom, when you go to the doctor, take a notebook down, and it can be a little, what we call the old penny notebooks with a pencil, and write down what the doctor's giving you and write down what he's telling you you're using it for. That's the quickest way to remember it. Okay. And on top of that, you can also take that one step further. And that is when you get that prescription filled, and I will tell you right now, I'm a very strong advocate of getting that filled in one location and one location only. Don't take it to multiple pharmacies and have this one filled here and that one filled there. Stick with one pharmacy if you have the ability to. You know, when you go to the pharmacy, ask the pharmacist as well. Hey, doctor says I'm taking this med for this. Is that right? Does that make sense? And get their perspective. And at the same time, how do you get that useful information that you can use? You can get that from your pharmacist. When you get your prescription filled, there is a requirement that counseling must be made available to you. Okay. And I'm sure if you've gone to even Walgreens or whatever, you're going to get the question, do you need to talk to the pharmacist about this? Do you need to talk to someone about this medication? Maybe not every time, maybe just the first time, maybe sporadically. Just because they don't offer it doesn't mean you can't ask for it. That is your right at any point in time to say, I'd like to speak to a pharmacist. I have a question. Okay. If they don't have the time to do that, find someone else. Okay. That is their job. That's what we signed on for, and that is what we do. Okay. The pharmacist can also provide you some very good information in the form of what we call the patient package information sheet. Most pharmacies these days, I'm going to go on a limb and say all of them have some sort of a computer program. Those programs have the ability to print out a patient information sheet about the specific drug, put in lay public terms so that people can understand it. You don't have to have a medical degree or medical background to understand it. It's put in very common and simplistic terms. Okay. You can ask for that. It can be printed out and you can have it to read it and keep it with you at all times. Okay. And if it helps you, or if it helps you with someone you're taking care of, have that sheet printed out, put it in a binder with whatever med you're taking at the time. You've got the name of the med, you've got the directions for the med, you've got what the med does and how to take it. And that information sheet will cover how you take it, when you take it, what you're taking it for, what to expect out of it, the side effects, when to call your physician, what not to take it with. It's going to have the whole list of questions for you there. By all means, utilize it. That's why the information is there. Okay. It's a lot of this information and a lot of the questions people have are very easily answered. Just ask. That's the easiest way to get the question answered, is ask the question and keep asking until you get an answer that you're satisfied with. Okay. Or until an answer that makes sense to you. Early on in my career, I was taught by someone that if you want to know the right answer, you have to ask the right question. So sometimes the question you're asking me isn't always the answer I'm giving you because I simply don't understand the question. So if I'm not giving you the answer that you want, ask me again. Okay. That's what I always tell folks. So by all means, utilize those resources. The internet, when it comes to useful information, I'm very hesitant to ever recommend the internet. The problem with the internet is a little information is a dangerous thing, as the old adage goes. And when you're reading something off the internet, unless it is from a very trusted source, and there are some out there. I'm not saying they're not. I think drugs.com does a pretty good job. But if you're just going on to a chat room or you're going on to some website and just asking a random question, you're going to have 20 people chime in. Well, this is what it did to my mom, and this is what it did to my dad. And oh, the last time I took it, no, that's not useful information. Okay. Useful information is what you get right from real trusted sources. If you're not real familiar with those, I would recommend that you stick with your pharmacist and your physician, and get the printable sources and the information from them. It will do you a lot more good and create a lot less confusion. Okay. That goes for mail order as well. Mail order should have and should provide that information to you. So there's no reason why you cannot have that immediately. Okay. So one of the questions that we often get, one of the questions that Lee had put in here for me is, knowing how long to take a medication, can you get off of it? Should you not even start it? Things along those nature. Very difficult to answer that question. In certain instances, you are going to take that medication and you're going to take it forever. If you have a thyroid issue, your thyroid is not going to get better. And once you start medication, you're on it. Okay. Unfortunately, I wish I could give you a clear answer, because when we talk about something about diabetes, most people think that diabetes is a lifelong problem that you're going to have, but it's not. There are instances where people have, you know, if you're 5'2" and weigh 600 pounds and you're diabetic, and one day you lose all that weight and now you're 5'2" and 110 pounds, there are people that no longer need support for their blood sugar. So to sit there and say, oh yeah, diabetic, once you got it, you got it. No, not the case. On the flip side, if your thyroid's not working, it's probably never going to work, and it's not going to get better. Okay. So again, how long you take it? Depends. It just depends on what you're taking it for. If you're taking antibiotics, one of the things we always recommend, and I'm sure you've probably heard this, is if you're given a course of antibiotics for whatever reason, take the entire course of antibiotics. Do not stop it if you start to feel better. Okay. Oftentimes what happens is that people will feel bad. They'll be sick for a few days. They'll go to a physician. They'll take the antibiotic for 3 or 4 or 5 days. The doctor can take a week's worth, maybe 10 days worth. So now they've waited 5 days to go to the physician. They start on the antibiotic. 4 or 5 days later, they feel better. And they think, hey, I still got 5 days worth of antibiotics here. I'm going to save that in case I get sick again. Not a good idea. First of all, just because you feel better doesn't mean you've rid yourself of the infection. Second, and most importantly, is anytime you start antibiotics prematurely, you run the risk for increased resistance later on, which means that that antibiotic that you took this time may not work next time. Okay. So we need to take the full course of antibiotics. We're never going to probably kill all of the infection, but we need to kill as much of it as we can so that the body can fight off the rest. Less chance of resistance that way, and better chance for long-term success and not having to take another course of antibiotics 3 or 4 weeks down the road. Okay. So that sort of goes along with how long I should take it. I wanted to throw that in there because that is traditionally one of our problem areas, is antibiotic therapy and people not taking it long enough or appropriately enough. Okay. The next thing that we had on the list, or that I had on the list, is how do you decide if you should take a medication and is it even worth it? I think that's a very personal decision. And I think I can't answer that for everyone. Okay. As always, we always talk about the risk versus the benefit. What's the risk of those medications and how much benefit will it provide me? And then the third question to that is this something I can take care of on my own? Okay. If you are borderline for cholesterol and the doctor says, you're really borderline, we could probably prescribe something, but have you tried changing your diet? Have you tried eating lower fats? Have you tried eating it? If you haven't done it and you don't want to take the meds, then there's your opportunity. No, doc, you know what? I haven't tried the diet. Okay. I need you to follow this diet then, and let's see what happens. Let's see where it goes. Okay. You're a little bit, your blood pressure is a little bit high, but you're about 30 pounds overweight. Do you want to lose that weight and see if your hypertension gets back into control? Your blood pressure is under control. You don't need the meds. Or do you want to continue to live the lifestyle that you're leading? And then you're going to be on meds. Okay. So Again, that's a personal decision. I can't answer that for you. Obviously, it depends a lot on your quality of life, and how severely whatever is going on affects your quality of life. I'm not believe it or not, even though I'm a pharmacist, I'm not a proponent of meds. I would much prefer everyone be on as few meds as possible. But that being said, I'm also a realist, and I understand that meds are a necessary part of life in some instances and in some folks. Okay, so I think the realistic view is we use as little as we can, but when we need it, we use it. Okay, and if you're not capable of implementing certain lifestyle changes or certain dietary changes or activity changes on your own, then you're probably going to be faced with medication, like it or not. Okay, and even once you start the medication, you still have to be aware of the fact that those things aren't going to go away. So if you're taking a med for diabetes, and I only tend to go back to that one because that's traditionally one of our big issues. People think, well, I'm diabetic, but the doctor put me on this med, so now I'm going to be good, so I'll just continue to eat what I want. No, it doesn't work that way. The med is to help assist you in getting better. It's not going to do the work for you. You still have to put the work in on your own. And in the case of diabetes, it's your dietary changes, it's your lifestyle changes in conjunction with the meds. Okay, the meds alone will not do it. In some instances, things like hypertension, sometimes meds alone will do it. There are people out there that are normal height, normal weight, and are still hypertensive. Yeah, it is what it is. You've got high blood pressure, you're predisposed to it in your life, and you're just going to have to take care of it from there. Okay, so you do what you can on your part, you do the best you can on your part, and let the meds fill in from there. Okay, supplement when and if necessary. Okay. So one of the areas I know Lee had put in here, and it's a bit of a complex area, so I'll try to go through it as simply as I can. Are there some medications that aren't good for me? Are there some medications I shouldn't take? Some medications to avoid? The answer to that is, in almost all circumstances, the answer is yes. Okay, because anytime we use a medication, it has the potential for problems, has a potential for side effects, for drug interactions, and things like that. So you can't ever say all drugs are safe. They're not. Eons ago, when I was in pharmacology, I had a professor who made it very clear to us. He said, drugs are like water. You can't live without them, and you can drown in an inch of them. And that was very much the case. His point being, we have to use it when we need it and how we need it, and understand that there are risks when we use it. Okay, and that applies to water just like it does to medications. Okay, several years ago, I want to say back pre-2000, maybe 98-ish, there was a gentleman by the name of Beers who came out with a list of medications. They were called Beers drugs, Beers criteria. You can do an internet search, but again, be careful on what you read. They have been updated about every 3 years since then. The last update, I believe, came out in 2019, or was published in 2019. I think the review took place in 18. The publication was published in 19. And what they've done, and let me real quick, because I hate to, but yes, Stephen Maxwell, we're going to talk about CBD, medical marijuana, and recreational. I will be getting to that towards the end, so hang with me on that one. The Beers drugs were put out, and it was a list of medications that were deemed to be potentially inappropriate for the elderly population. Okay, and when I say potentially, if you look at the way that it's phrased, it is phrased as avoid. It does never, it has never said do not use. It has said avoid. Okay, and that avoidance, it can be either based on age, based on medical condition, or based on just certain other aspects like falls and predisposition to falls and things like that. Okay, so understand that even when we're talking about a medication like, even we're talking about a medication that would fall onto the Beers drugs, just because it should be avoided doesn't mean it should not be used. Okay. It should, in some cases, it may be our last resort and it may be our only option. Okay. So for instance, I'll give you the perfect example. If you read the drugs, you are going to see that opioid analgesics, Vicodin, oxycodone, things like that are to be avoided in folks that are predisposed, in elderly residents predisposed to falls. Okay. Very plain recommendation on there. What do you do when someone has already fallen and has now broken a hip, a leg, etc., and they're in pain? Do you not treat the pain, or do you make sure that you monitor them so that they don't fall while they're on the med? Okay, therein is the quandary. We need to avoid it, but there are times when we have to use it. Okay, so you have someone who is predisposed to falls. They've fallen 3, 4, 5 times, and all of a sudden on the 6th time, they break a leg, they break a hip, they break an arm. Now they come home and they're on a Vicodin because, let's face it, they're in an extreme amount of pain. Okay, we cannot allow their quality of life to continue being in pain. That's inhumane. Okay, what do we do? Well, we're probably going to have to prescribe an opioid, and in that case, we're going to have to use extra care and be especially prudent to make sure that they're not getting up and trying to maneuver on their own, that they aren't going to try and fall while we aren't watching them. Okay, so if you should happen to read that list of Beers drugs and you see all these meds, and right now I think I just looked about an hour ago because I was kind of curious myself. I could not count the number of drugs on there. Okay, there are 30 drug and or drug classes. So when you're talking about a class, you may be talking about 50 meds in that class. There are 30 drug or drug classes that should be avoided. Okay, there are another 40 drug or drug classes that should be avoided under certain medical conditions. So if you just think about that logically, at minimum, you're talking about 70 drugs. But when you're talking about drug classes, you're talking, I'm sure, well into the hundreds of meds that fall onto that list. So while I believe in that list and I use that list, we have to temper that knowledge with, there are times when certain things are unavoidable. So we need to sort of, just because it's on that list, say, oh no, we can't use it. That's a Beers drug. Let's look at what we've got. Let's look at what our other options are, because maybe, yes, we shouldn't use that drug as a first line agent, but when we have 5 possible ways to treat something and treatments 1 through 4 have failed, number 5, which is on the Beers list, now has become our only option. So now we need to be aware that it's on the Beers list. We need to be aware of what precautions we need to take because we are using a Beers drug. Okay, so let me just put it kind of like that, because I don't ever like to limit ourselves in the arsenal of meds that we have at our disposal. Okay, I'm a very strong believer in prioritizing first line, second line, third line, etc. And obviously meds that are on Beers drugs obviously fall very low on that priority list when it comes to the elderly. So what it does is it moves them down in our treatment profile, but it doesn't necessarily preclude them entirely. Okay. If you're taking a med, or one of your loved ones is, the questions that I get a lot of time is, when should I be concerned? Is it a side effect? Is it a known effect? Is it an allergy? Is it not an allergy? I can tell you right now that if you look at any, and I mean any med that you take by mouth, one of the side effects listed is going to be nausea and vomiting. Okay. Every med out there has nausea and vomiting if you take it by mouth. The very simple reason for that, and it applies to all meds, is that when they do the drug studies, they are obligated to report every side effect and every possible side effect that has ever occurred. Well, when you're giving a med to 5,000 people, someone's probably going to be nauseous at some point in time, and therefore they are obligated to report that. Okay. What we have to look at is not, is it a side effect, but how often does that side effect occur? Okay. So nausea and vomiting might be a side effect in 30% of the people. I'm just going to be really silly here. Growing an ear out of your forehead may be a side effect in 1 in 20 million people. Okay. If you take a med and you get nauseous, I'm not going to get too concerned about it. You start to grow that other ear, we probably think it's probably drug related. Okay. So, and I don't mean to be a smart aleck over that, but again, we have people call and say, well, I took this and it upset my stomach. Okay. Yeah, I'm sorry, that's possible. When did you take it? How did you take it? If you're supposed to be taking it with food, did you take it with food? Sometimes we can avoid those issues. If a certain med upsets your stomach a little bit, you're only taking it once a day. Sometimes we just give that med at bedtime, because you go to bed, you fall asleep, and then you don't know that you're a little bit upset in your stomach. Okay. If it's terribly upsetting that you're actually throwing up, yeah, that's a concern, and we need to address that, and we need to take care of that. Okay. And I think, when you look at it and you say, is this a known effect of this drug? On most occasions, if you're going to look at it, you're going to see that there are a lot of known effects to medications. Some of them are obvious, some of them are not as obvious. But that is where that patient information sheet will help you, because those patient information sheets are usually arranged in such a way to show you the most common side effects. So if you look at that sheet and you see, I'm a little bit nauseous, and you say, oh yeah, that's pretty common, then there's your clue. Okay. If you suddenly say, man, I took this med and I'm seeing double, and you don't see that as a side effect, then you need to address that and follow up on that in some fashion as quickly as possible. Okay. And then we get into the whole, is it an allergy or is it not an allergy? Okay. And I'm sorry to tell you that just because a med gave you an upset stomach does not make you allergic to that med. Okay. In my job, we have a lot of folks that are admitted on a daily basis to say they're allergic to this or they're allergic to that. And then when you go in and you find out what their quote allergy was, well, it upset my stomach, or it made me feel weird. Okay. That's not an allergy. That's an adverse drug effect. It's a side effect. And again, it goes back to, maybe it was something we expected, maybe it's something we didn't expect, but it's not an allergy. An allergy is hives, trouble breathing, throat swelling up, okay, eyes swelling shut. Those are allergies. Those are severe, and those are nothing to be fooled with. We need to address those and take care of them right away. I cannot tell you how many people I have had in my lifetime that have said they are allergic to codeine. And I cannot tell you how many people are actually truly allergic to codeine, because it is a significantly lower number. And one of the stories I always tell is that you say to someone, well, I'm allergic to codeine. And I say, well, what was your allergy? Well, it made me throw up. And with that one, I sit there and go, okay, let me guess. You had your wisdom teeth taken out. The doctor gave you Tylenol with codeine for your wisdom teeth. You took 2 of them right away because they told you to get them into your system as quickly as possible to avoid the pain. And then you threw them back up. And a large percentage of the time, it's like, well, yeah, that's exactly what happened. Okay. So you took codeine on an empty stomach. Codeine is very upsetting to your stomach anyway. You just took it after you had a dental procedure where you hadn't eaten for 12 to 24 hours prior to the procedure. And when you had the procedure, you swallowed a butt ton of blood because you had your wisdom teeth taken out. So now your stomach was already upset, and you put codeine on top of it, and you threw up your Tylenol with codeine. Does not make you allergic to codeine. Okay. It means you had an adverse event, and it was brought on by a multitude of factors. One being that you just had codeine on an empty stomach that was full of blood. Okay. So again, when you're talking about allergies and you go anywhere and they ask you, are you allergic to anything? Please be sure to differentiate what is an allergy and what you've been intolerant to in the past. And by that, I mean, if you go to a new physician, or you go to a physician that says, I'm going to give you XYZ, have you ever had that before? Are you allergic to anything? You can say, oh yeah, I had that before and my throat swelled shut. Okay. Yeah, doctor, I did have that before, but you know what? It made me feel weird. I felt real dizzy after I got it, or I felt very nauseous after I got that. I really had some bad effects from it. Be sure you differentiate what whether it was an allergy or whether you were just intolerant to that medication. Okay. Because sometimes when you're intolerant, again, we have a workaround, and I don't want to limit our arsenal of what we can use to treat you just because you describe it as an allergy when actually it was a side effect or a known effect. Okay. I hope I've made that clear and not muddied those waters too much. Okay. So we talked about earlier, OTC precautions are over-the-counter meds. All right. The common, and we're going to go into kind of, I'm going to kind of go into these are kind of all going to blend together because in my eyes, they kind of all are the same. We're talking about over-the-counter medications. We're also going to talk about supplements, and we're going to get into the medical cannabis and CBD discussion. Okay. Because in the case of all of these, they're not necessarily prescription medications. Okay. Over-the-counter medications are meds that you can go to Walgreens, Walmart, Kmart, wherever, whoever you have. You can go to the local gas station and probably buy it off of the shelf. And so when that, I mean, you can probably, I bet you, I can go to the 7-Eleven right now and buy aspirin or a Tylenol. Okay. It's over the counter. Okay. Does that mean it's perfectly safe and you're good to use it? No. It means it's perfectly safe if you use it the way the instructions are written on the package. Okay. With any medication, if you're going to use it, you should always contact your physician first to make sure that you are okay using it. Don't just go out and blindly buy something. Okay. We have decongestants out there that are known to raise your blood pressure. Not good if you already have high blood pressure. Okay. So what we need to do is understand that, hey, I need to take another decongestant that doesn't interfere with my blood pressure. Guess what? You can buy those both over the counter, and they're probably on the shelf right next to each other. Okay. So knowing which one to buy and picking and choosing the right one is important. And it also can be very unsafe to choose the wrong one. Okay. Likewise, Tylenol. Tylenol is a great pain reliever. I'm a very big proponent of Tylenol, but if you take Tylenol over the course of a day, it will basically ruin your liver and you will suffer from liver failure. So when they have recommendations on that bottle not to exceed 4 grams per day, and in some cases 3 grams per day, I would suggest you best heed that warning. Okay. Again, make sure you're even okay to take that with your physician before you take it though. Okay. Over-the-counter meds in some cases are no different than prescription meds. They're just a lower dose. I see a question in here from Sandy. Yes, I'll talk about the protonics for you, but things like Prilosec that you get over the counter, those meds are the same that's found in the prescription. They're just at a lower strength. Aleve, same ingredient as a prescription strength. Ibuprofen, okay. Advil, that's the one that everybody is familiar with. Advil. Advil is available as a 200 milligram tablet. The prescription strength is 800 milligrams. So if you're taking 4 of them, you're taking the same as the prescription strength, but one requires you to have a prescription from the physician, one you can buy over the counter. Okay. So don't think that just because it's over the counter, it's not as good, it's safe, or it's not going to work as well. It's just safe and effective under the terms outlined on the box. Okay. Again, contact your physician, you can even ask your pharmacist, say, hey, I got a little bit of sniffles and I need something for sniffles. You taking any other meds? No, I'm not taking any other meds. I just kind of want something. Okay, then try this. I need something for cough. Okay, try this. That's certainly a possibility that you can do. And especially if you're going to a pharmacy, a lot of the smaller retail operations that have been around for years, they know their customers. They know them when they walk through the door by name. They know their kids, their grandkids, and their dog. They're going to know what you're on. They're going to know what you're taking it for and probably your whole medical history. So they're going to be able to guide you in the direction that you need to. Okay. Along those same lines, supplements. That gets into our whole, what we call nutraceuticals. From a professional standpoint, you're going to go to Walmart, and I'm going to say Walmart because that's as good as any, and you're going to find a whole section of ginseng and valerian root and purple goat weed and who knows what else. And they're all going to claim some magnificent medical benefit for you. I am not going to say that those plants as such do not have medicinal properties. That would be inappropriate for me to do. What I will tell you is if there was money to be made from those plants, Big Pharma would have trademarked them and put them out on their own years ago. Okay. When you think of supplements, remember that part of the problem with supplements is they do contain an active ingredient. Okay. What they don't tell you is what that is and how much of it is within there. It's not been what we call assayed. When I give you 5 milligrams of aspirin, I know there are 5 milligrams of aspirin in that tablet. Okay. When you take 100 milligrams of ginseng, okay, ginseng is just the name of the plant. It's not the active ingredient within that plant. Okay. And anytime it comes to naturally occurring items, there will be variation within the production of that item. Okay. For those of you who have ever had a watermelon, one was sweet and the next one wasn't. Well, the amount of sugar that was produced was what you're looking for. That is, for lack of better term, the active ingredient. So if I just gave you 4 slices of watermelon a day when you were actually looking for the sugar, it could be pretty dramatic as far as how satisfying and how beneficial that was for you. Okay. So the problem with supplements is we don't know how much of that active ingredient is in there, and therefore we don't know how it will affect you from bottle to bottle, from manufacturer to manufacturer. Okay. So be very, very leery of them. And by all means, if you're going to use them, make sure to tell your doctor, your pharmacist, whoever it happens to be. Okay. When they go into the physician, they say, are you taking any other medications? And you're going to say no. And you got 6 bottles of supplements sitting on the shelf of some various varieties. That's important to know. They need to know your supplements just like they need to know your prescription medications. Okay. You cannot exclude them just because, well, they're a supplement. I buy them over the counter. That's not a reason. They need to be addressed. Okay. So yes, they absolutely can interact. They absolutely can cause problems. I'll give you a perfect example. One that people are probably may or may not be familiar with, but a lot of folks through the years have heard about sassafras tea. Sassafras actually contains a very, very well-known blood thinner. And there have been people who have taken medications to thin their blood and continued to drink their sassafras tea. And guess what? Their blood got too thin because we didn't know why. Well, it was because they were drinking the sassafras tea, and it was having what we call a synergistic effect. Okay. Yes, Stephen, supplements should be listed on the MARS. Those are important to know. As someone who does long-term care, I can tell you that one of the questions I ask when I evaluate for falls or drug interactions is, do they take any supplements or do they have any medications at bedside that they're taking on their own that we do not know about? So absolutely important to know that. Okay, because again,
tell us what the MARS is.
The MAR is a medical administration record. It applies mostly to residents who live in long-term care facilities, skilled nursing facilities, assisted livings, things like that. Okay. So yes, I guess what I'm saying is I want you to think of the supplement, even though supplements and OTCs, I want you to think of them as a medication, even though you're not taking and getting them with a prescription. I want you to think of them as a medication. Okay. Yes, Nancy, it says often the OTCs have an info sheets is very long, making it know for sure what to do and not. I agree. If you go under the dosage section, it's usually fairly common to have, the dosage section is pretty well cleared out. Tells you exactly how much to take and when to take it and not what not to exceed. Okay. And that's the big thing to note under the directions is dosage and what not to exceed. Okay. So if you've cleared it with your physician to take, then knowing what the max amount per day or for 24-hour period is really your biggest concern from there. Okay. Medical cannabis and CBD. I am going to hedge a bit on this because by federal law, medical cannabis is still a class 1 narcotic, which means it falls into the same category as heroin and LSD and magic mushrooms and all the rest of those. As a pharmacist, I am bound to follow the most stringent law, which means it doesn't matter what the state says when it's legal or illegal, as long as the federal government says it's illegal. To me, it is still illegal. Okay. I'm going to qualify that by saying that I'm going to put medical cannabis in the same category as supplements. It is a naturally occurring product. I do believe there are probably medicinal benefits to it. I don't think we've done the studies we need to find out what those are and where they're going to take us. Part of that is because of the federal regulation. It's very difficult to do studies when it's a class 1 narcotic. Okay. I'm going to give you my personal opinion, which is going to be that it should not be a Schedule 1 narcotic. Okay. It is not anywhere in the same category as heroin, LSD, or magic mushrooms. And if you look at some of the data that's coming out there right now, they're even saying that some of the mushrooms may have some medicinal properties. So I think that whole natural med theory is probably true. The majority of medications that we have these days were derived from something natural to start with. All we have done is purified it, synthesized it, and made it more potent. So there probably are things within the marijuana, within the oils and some of that are beneficial. What they are and in what quantities, it's very hard to say. Will it affect other medications? Again, very hard to say. We don't know what those interactions are. We don't know how much has been taken, what the potency of was taken. I can guarantee you that folks that are much more astute at this than I am will tell you that certain cultivars and growing procedures will make a much more potent cannabis than others. So what you take, where you get it from, how much of it you take, there's a lot of variables there, and we just don't have standardization to know what works and what doesn't. Okay.
Can I jump in? Because there's
absolutely.
a little. So just because, first of all, yes, we live in a medical marijuana state, but people don't understand that in a long-term care facility, it can't be used because of the
federal. That is correct. That's correct.
There is one exception to it, and people, my son was on it. So there is a CBD oil that is FDA approved, that is rare on occasion used for seizures. It's called Epidiolex. But,
right.
You know, and I can tell you from being the mom who waited for 30 years, this isn't the end all cure all either. Like for us, it was the worst failure med my son ever tried. So I think it's important that people hear that side of that it might work for one person, but not another. And even though the doctor says, sure, use it, the long-term care facility cannot. They will lose their license. And it's important that people understand that, because we had to jump through a lot of legal hoops to even use the Epidiolex in a long-term care facility.
Right. And that is the same reason why you don't have pharmacies dispensing it, is because of that. Okay. That is why you have cannabis dispensaries. Okay. Because we are still bound by that federal law. Okay. And there is a difference for those that aren't familiar. There is a difference between medical cannabis and CBD. Okay. CBD is a cannabinoid derivative and does not have the THC content that medical marijuana or medical cannabis does. THC is the active ingredient that everyone is worried about as far as the, I guess, the fun effects that everyone gets from smoking their joint or whatever you want to call it. But the CBD is much is purified out. And if you look at most CBDs, they are going to tell you, they're going to show on there that they're less than XXX percentage of THC involved. That means that they are trying to avoid being shown on drug tests. They are below the limit, which then is considered medical cannabis, or that is considered even marijuana in general. So CBD and medical cannabis are two distinct things. The CBD oil, again, yes, there is some evidence out there for seizure control. There are more studies being done with that. And that goes back to what I said initially, which was we need to do more studies, because there are certain ingredients, there are certain cultivars within that cannabis. There are certain oils and compounds. Some have stronger properties than others. So to make this as simplistic as possible, let's say every cannabis plant has 3 active ingredients, A, B, and C. We find that A is better for seizures and B is better for anxiety and C is better for pain. Once we know what that active ingredient is, we can now cultivate specific medical marijuana plants to enhance the A level, the B level, the C level. So until we can get those studies done, it's going to be very difficult to know exactly what those effects are, but I'm not discounting that there are effects there. Okay. Let's see. Let's move on real quickly from there. Then we're getting close. I want to allow some time. Trade product versus generic product. I get that all the time. Trade drugs and generic drugs are exactly the same thing, the same amount of active ingredient. The only difference that you may find between a trade product and a generic product is the inactive ingredients, and that is the ingredients that hold it together, okay, and give it its ability to stay as a pill, okay. I've had people say, well, trade products work better than generic. I've had people say generic work better than trade. It has nothing to do with the potency of the active drug. It has to do with the other items that are in there and how your body breaks that down and allows that drug to be absorbed into the system, okay. Don't think because you're being forced to take a generic, it's necessarily a bad thing. And also understand there's a lot of generics out there for you. And just because one generic brand doesn't work, doesn't mean another generic brand won't work. Okay.
And Craig, there is a question
Yes.
in the chat box
Yes.
that's so timely for what you're saying.
Yes.
It says, somebody wrote, I just use CO
Yeah. Enzyme CoQ10. Yes. Yes.
And they said it's such a big difference in price, the over-the-counter brand.
Yeah, and it's this. Well, that's just it. It has to do with how much is in the particular one. What's the potency of it? And beyond that, as long as the potency is the same, it's the same.
And we can see it from reading the label. We'd be able to tell us
absolutely.
From reading the label.
Yes.
Or we could bring it to a pharmacist, and the pharmacist could tell us if it's the same.
Yes. Yes. Now, some folks may choose one form or one brand over another because some of those things like CoQ10, those tend to get a little bit larger in size. So they may find, well, this one's easier to swallow or this one goes down better. But the fact of the matter is, once you look at active ingredient, all things being equal, yes. So 100s are exactly the same. USP from Nature Made. USP from Nature Made. Nature Made is a producer that is actually probably the one that I recommend you use for everything if you're going to buy. The USP stands for United States Pharmacopoeia, which means they have been assayed and are within specs of what the pharmacy, so the United States Pharmacy says it should fall within from a potency and strength and potency standpoint. Okay, so if you have your choice of anything that says USP versus anything that doesn't, my recommendation is you always choose USP because they are going to have to fall within certain parameters. So your standards are going to be much tighter on a product like that. Okay. And lastly, before I ask, there's a couple more questions I'm going to answer in here. And then the last thing I do want to get a hold of, talk about real quickly is, this is something completely new that we do at the pharmacy. We've been doing for several years now. It's called pharmacogenetic testing. It is a genetic test, not in the traditional state of telling you who you're related to or who your great grandfather's fourth cousin was. This is the same type of test. They swab your cheek, they run the report, and it will tell you which medications you are most likely to respond to. And not only which ones you will respond to the best, which ones will have a higher instance of side effects, which ones might need a higher dose to get the same effect. It gives you a wealth of information. There are several companies out there that do this, including the Mayo Clinic. I have worked with 3 of them, including the Mayo Clinic. They're all effective. It depends on how you're able to interpret that report. Okay. I recommend it for anyone who is elderly, for anyone who is on any meds for behaviors. So an antidepressant, an antipsychotic, an anti-anxiety drug, any of those types of things, seizure meds. Those are all things that show up on this pharmacogenetic test. It can show you the efficacy or lack of efficacy thereof. A lot of physicians do not know about it. A lot of them are hesitant to try new things, but more of them know about it than you think, and a lot of them will do research and accommodate you if you ask. So I think for a lot of folks, it may be something, do your research on the pharmacogenetic testing, either through the Mayo Clinic. The other site is called GeneSight that we use. That's the one that we use in our facility. They're both very user-friendly. You can go, I know GeneSight has their own website. It's GENE, and I don't know if it's SITE or SIGHT. I'm kind of sorry, I'm not in the right frame for that right now, but you can do a website search of them. They explain what they do and how to go about getting the test run. I can tell you that it has provided a lot of information and very useful for the folks that we serve, and especially when you're on multiple meds and in certain classes of meds. Okay. That's all I've got. Let me get a couple. I did have a couple questions that I'm sorry I skipped over. Let me scroll back here. Sandy, medication like Protonics, 1 hour before breakfast. What happens if you can't eat for 2 hours? Does that just mean taking it on an empty stomach, or is the hour timing critical? 2 hours is fine. You need to take it at least an hour before eating. So we like to get it in there. If you can take it an hour to 2 hours before, it does not just mean empty stomach. We like to take it on 1 hour before eating with the breakfast. Proton, that is called a proton pump inhibitor. The way those actually work is they wait for those little pumps in your stomach, little acid pumps in your stomach. They wait for them to turn on. They come in and they turn them off. But the drug does not work unless the pump is actually on pumping acid. So the reason we do that is we tell you to take it an hour before breakfast. It takes about an hour for an oral med to get into your body. You take your breakfast, you eat your breakfast, those pumps turn on and it shuts them down. Okay. And it's the 24-hour drug. So by the time by the time lunch comes around, those pumps shut on and turn on again, and it shuts some more of them down. And each time those pumps come on, it shuts more and more of them down. Okay. So we want to take it in the morning because that way we get the benefit of using it all three meals of the day, and helps you all the way through till the next morning. Okay. So yes, preferably, we say 1 hour before breakfast. I tell folks 1 to 2 hours before breakfast, but always before breakfast in the morning. Okay. That's the big thing, because that's the way it's going to become the most benefit to you. Okay.
So
Doesn't say you.
Craig, are there a lot of meds that are like that? Because I did get a question just sent to me personally. Is the time you take medication important to achieve the maximum benefits?
It can be for certain medications, yes. And certain medications are always going to come with a time that they're best utilized. Okay. A lot of our statin drugs for cholesterol, we've always recommended in the past to be given around supper time or around with the evening meal. That has to do with biological processes in the body and the fact that the drug is peaking in the middle of the night when these processes are peaking. So therefore you get the maximal effect out of the drug. Okay. Certain meds can be given either day or night. It's just, I always recommend that if you're going to give it, make sure you take it the same time every day. Just because it's once a day, don't take it in the morning one day and the evening the next. If it's once a day, if it's an aspirin once a day, if it's whatever, take it when you're supposed to take it at the same, at that same time every day. Thyroid medications. I'm sorry.
Can you explain to people what a level med is and why that falls with kind of those things also?
You mean the drug levels of a med?
Yeah, well, like,
Yeah.
like either a psychotropic or an anticonvulsant, and how you build that level and why
Right.
that consistency is
Right.
important.
So as you take a med, the drug level goes up, and then your body gets rid of it, and then you take another dose and it goes up some more, and then it gets over. You think of it as you have to hit a certain point to trigger an effect, like flipping a light switch. And our goal is to flip that switch to get it to turn on, and then to keep those drug levels, those beneficial levels above that light switch. Okay. To keep that switch turned on all the time. Okay. If drugs are made to be dosed at a certain interval to provide that effect. So that might be every day, that might be every 12 hours, it might be every 8 hours. Anytime you deviate from that schedule, it allows those levels to go lower and potentially fall below that triggering point, and therefore it'll take you longer to get them back up over that point. So in the case that Carrie just said, for instance, seizure meds, when we fall below that level, we run the risk of triggering a seizure. Obviously, that's not something we want to happen. It's a very obvious thing that occurs. and a very dangerous thing that occurs. But over the long term, consistently having loss of blood sugar control, cholesterol control, of your blood pressure control can be just as devastating. It might just take just as long to get to the same point. Okay, so we need to keep them on that same schedule to get the maximum effect so that the drug can work pharmacologically the way it's designed to work. Okay. Let me just scan through here real quickly. Let's see, I was taking, Sandy said for years I was taking a probiotic every day, although I didn't really know how many billions I should be taking, and ran out about 2 weeks ago. Don't feel any different. When is a probiotic actually needed? Well, need is if you've been on a long-term course of antibiotics, always a need to prevent any secondary bowel infections from that, or overgrowth of bacteria. So we always recommend probiotics in situations like that. If you have gut issues or prone to gut issues, there are certain times when probiotics are recommended. It's been quite a nice marketing routine to try and promote gut health to a lot of folks, and try to push either probiotic, yogurt, or whatever. The fact of the matter is, you can take probiotics or you can eat yogurt. I mean, yogurt's going to give you the same, what we call active cultures, and the same sort of good bacteria that taking a probiotic pill will. So if you're concerned about gut health and you don't want to take the pill, but you like yogurt, I'd say go out and eat yourself a yogurt every day, throw away the pills, eat your yogurt, and that way you enjoy the yogurt probably a lot more than swallowing the pill. And the cost probably is not going to be a whole lot of difference in the end. And even if it is, you're going to have a lot more fun doing it. So, I would go that route. But in the case of an antibiotic, especially if you've had long-term or you're a routine taker of antibiotics, probiotic and probiotic supplementation with pills is probably a good idea. Okay. Did I have any more questions on here that I missed or did not answer to your liking that I can address?
I think, Craig, I think we probably could have continued this conversation for another hour, but we are after the 4 o'clock mark. And I think a lot of people really benefit from this. One question did just come up. As one gets older and metabolism slows down, does one run the risk of medicine overaccumulating in the bloodstream?
In some cases, absolutely. It doesn't have as much to do about metabolism as it has to do with your kidney function. 99% of drugs are excreted through the body. In other words, gotten out of the body one of two ways, either through your liver, which is through your gut, or through your urine. Okay. The vast majority are through the urine. So the problem with drugs accumulating as you get older is not necessarily, quote, metabolism, but the fact that your kidneys just don't work as well. Therefore, your kidneys don't excrete it into your urine. And yes, drug levels can build up. That's why, as a physician and as a pharmacist, especially in the geriatric population, we are always concerned about renal function, because we have to monitor that closely on some medications more than others. And in fact, some medications, one of the drugs on the Beers criteria actually just doesn't work in the elderly because it's an antibiotic for urinary tract infections, and the body does not excrete it into the bladder at a high enough rate to kill the infection. So you're not recommended to use it, not because you can't take it, not because it's bad for you, just because it doesn't work. It doesn't work for you in that situation. All
and
right.
Craig, I did look up to see if I could find a link for the Bears list, and it kind of bring me down a rabbit hole.
Oh, yes.
If you could send me that link, then I can put it with the materials for this meeting.
I tell you what, I have the PDF of the article that was published. I will send you the entire PDF copy, and you can print the actual study with the lists in there. Okay. That
would be great. And I can link it to Facebook as well as to our material page for our Resident Family Support Council on our website. So that would be helpful for everyone. Thank you. Okay. Craig, I think we heard a lot of really great stuff. Some takeaways. I really think the ideas of that notebook, being aware, I think you gave it very clear that we need to be aware of what our medications are. We need to understand the side effects, and, try to design a system for yourself and or for your loved one, if you're the primary caregiver for your loved one, to make sure that you do know the medications that they're on, to really make sure that people can continue to live that good life that they deserve to live.
Absolutely. And remember, in the end, the only true advocate for you is you. So in the end of the day, it all comes down to you. And if you're not getting the answers and you're not happy with the information you're receiving, keep digging until you get that information. Okay. Because nobody's going to fight the fight for you. Okay. And if you're advocating for someone else, fight their fight just like you were fighting it for yourself. Okay.
Yes, and you got a shout out from from Sandy, who said you just saved me a lot of money for selecting supplements.
Outstanding.
More expensive than
Outstanding.
Sever, which is great. Yes,
Hey.
and I'm going to go ahead. I'm just going to do the poll real quick.
Sure.
Launch the poll for everybody. We just do a quick poll at the end, and I will end the recording now.
Hold
and I
on
just
real
wanna
quick.
thank you
Steven, did you have a
again.
question?
Yeah, well,
Yes, we're going to stay
I had
on.
a-
I'm just going to end the recording. We'll
Okay.
stay on.
yeah, well, I had a story I wanted to